Hello and happy Friday. We often get asked, how do you rejuvenate the neck? And I'll tell you, it's actually very difficult. And the reason why is because our neck skin is so much different than the rest of the face. It's thinner, it has less of what we call the pilosebaceous units, which are those areas that are either the hair follicles or even the sebum glands, so that you can't treat the neck in the same way that you treat the face. It just won't tolerate it. So we have to be much more careful with our choice. The skin is inherently thinner as well, so some of the other treatments we do in the face, let's say a laser, we can't do to the same degree in the neck. So what can we do? Well, the first and foremost, you want to prevent damage in the first place. So make sure you're doing SPF on the neck as you're treating your face. Number two, when you start talking about rejuvenative topical agents, things like the retinoids are really kind of first and foremost. The problem happens to be that if you try to do something that's more aggressive, like a retin-A, it may not be tolerated, but some of the retinols, for example, will, or some of the kind of neck-specific products that have retinols in them were also well tolerated. Things like Skin Better Science makes an alpha-ret tech neck type product for that. Works quite well. Antioxidants have a great role, so the vitamin C type products also help. Again, not a great reversal agent, but a good protective agent. When you start talking about peptides, that seems to be all the rage. Zeo Skin Health is a great new neck product that's in that category. So those actually do help also to add collagen and elastin back into the skin. When you start talking about interventional treatments, things like radiofrequency devices or microneedle devices or even ultrasound devices, I've stated it before, again, I'm not a big fan. We've seen a lot of damage from those and or not enough results. So I would stay away from those. There are topical treatments that you can do in the laser realm. So again, light laser treatments, again, backed off a little bit from the lasers that we would do on the face. We typically do a lot of halo, and now we're going to be doing tribrid in the neck. So that will be a nice way to treat areas to try to get a lot of the color irregularities and try to get whatever texture irregularities we can get with that level of safety. You can do interventional treatments that are injection-based. So again, neurotoxins, really good for bands. If patients have either that anterior neck band or even a little bit of that kind of persistent tone in the neck that might make some irregularities, those do well with neurotoxins. If you do the filler realm, you can do those as well. And in many cases, you can do either a dilute or even a hyperdilute version, including things like Sculptra for the neck. And then finally, for those patients who want full rejuvenation of the of the shape of the neck, then you can do surgery. But again, we always make the point, you can reposition things in the neck, but you're not changing the skin with surgery. So there may still be that crepe-like quality of the skin. It might just be in a new position. So surgery as a standalone is not a neck-only treatment for surface irregularities. So again, it is difficult, but there's some wonderful different ideas to use in that realm. And again, they're exciting new introductions, including things like red light. So we'll see what is the latest, greatest technology, including some that we're going to probably be rolling out this month. So anyway, if you're interested in neck treatments, come on and check it out because everybody's a little different.